CEO and author Michael Margolis says, "The stories we tell literally make the world. If you want to change the world, you need to change your story." For nearly 61 million people living in America's rural places, their stories where health is concerned has been a tale of increasing disparities. In print and on podcast, all of America is exposed to the familiar rural-specific narratives of older, sicker, and poorer. The opioid epidemic placed rural at the center of kitchen table conversations, in large part because the stories being told were gut-wrenchingly painful and heartbreaking. And although data detailing the shocking realities of overdoses were coming to light, it was and remains the powerful stories that spurred a nation to act. Like no other technique, a 2-minute story seen by millions can bring attention to a crisis that might otherwise go unnoticed.
49-year-old Jared Sopier was playing softball 3 years ago when suddenly he went into cardiac arrest.
If there had been no ambulance there and the people wouldn't have acted the way they did, I probably wouldn't be here.
But now in his small town and others like it across the U.S., a shortage of volunteer EMTs is putting these services on the verge of collapse.
How dire of a situation is it here?
Extremely, and that's putting it mildly.
In rural Marmarth, North Dakota, no one remembers the last time the town had a doctor. The ambulance is the community safety net.
We are literally one person away from closing. If we lose one of our EMTs, one of our care providers, we will have to look at shutting down and closing our doors.
Experts now warn that close to 1/3 of all rural emergency medical services are in immediate danger of closing down.
Nobody would ever imagine a world where you call 911 and nobody shows up. But here we are.
As many as 70% of EMTs in rural America are volunteers. Neighbors helping neighbors. This is essentially a side gig, but one that occupies a lot of time.
Yes, sir. This consumes a lot of time between training, hours spent with upkeep with the service.
It's not just that 12-hour shift, but every year you have to be trained, you have to be certified, and then you have your real job.
Right.
Most states don't fund these services. In 39 states, EMS is not considered an essential service like police and fire. Even experts are surprised that up to 60% are paid for by community fundraising.
It's fish fries, it's, again, the spaghetti dinners at the local church. We're relying on that as our funding stream to fund one of our most essential medical services.
I think we got to make it easier for volunteers to serve.
In Washington, some lawmakers are proposing measures to entice new volunteers, ranging from retirement packages to free utilities.
Making sure that they get the benefits that we would like to see every American get.
What happens if my family is the one that needs the ambulance that day, for whatever reason, and there's nobody here?
The system that is supposed to save Americans now in need of a rescue. Dr. John Torres, NBC News, Marmarth, North Dakota.
Just as it is important to keep stories like the clip you just watched front and center, today we will focus the conversation on narratives that reveal much more of the rural health story. Because for every rural health disparity and challenge, for every data point and key finding, there are incredibly important stories about the power of rural, the people and the organizations driving change and going the extra mile for rural health equity, to increase access to essential services, and to successfully address the social determinants of health that are unique to nearly 20% of the United States population. The National Organization of State Offices of Rural Health welcomes you to Masterclass and Telling America's Rural Health Stories.
What I know about storytelling is that it's all about answering questions, right? Y'all know better than I about the importance of being able to answer questions and articulate the why, the purpose, my why, and why the National Organization of State Offices of Rural Health and the state offices of rural health across the country do what we do in the way that we do it is to help rural health providers help their patients, neighbors, and communities become and remain more well. With that said, we need y'all to help us tell our stories, to help us articulate our whys, hows, whens, and wheres. I'm Tammy Norval, CEO of the National Organization of State Offices of Rural Health, known as NOSORH, which is the member association of the 50 state offices of rural health across the country dedicated to capacity building and support. I'm delighted to welcome y'all to today's event, telling the stories of rural America, and fortunate to have the opportunity to introduce our event facilitator. Michelle Rathman, President and CEO, founded Impact Communications back in 1989, working with authors. She helped them develop their ideas into books, get them published and gain them publicity, even landing her first author on the acclaimed Oprah Winfrey Show. In 1996, though, a cancer diagnosis changed everything. Michelle shifted the company's focus to healthcare, first urban and academic, and then to rural. But that's another story for another day. 7 years ago, Michelle and her team answered an RFP to help us here at NOSORH transform National Rural Health Day, which, by the way, is about to celebrate its 12th year. Help us transform that from a moment into a movement. And with over 60 million impressions of the hashtag Power of Rural last year, I think it's safe to say that together, with y'all here joining us today, we're well on our way. It's my privilege and honor to introduce our event facilitator, Michelle Rathman. Michelle.
Oh, thank you, Tammy. Thank you, everybody, for being here today. I must admit I'm a little bit blown away because we've had almost 470 registrations for this event, which tells me that storytelling is really important to everyone here today. I'm going to just tell you a little bit about that rural story that Tammy touched on earlier and why I am so passionate. And for those of you who may or may not know my work, why I'm so passionate about rural health. When I first started in rural health, as Tammy said, I had a booming book of business with authors, over 250 of them. I was diagnosed with malignant melanoma, and I ended up at a very big university, teaching hospital, as they say. And I ended up being awake on an operating room table. There's a story that I share openly when I speak. And that experience changed my life, as most people here can probably attest to. An interaction with a healthcare organization can change your life, sometimes for the better. For me, I believe cancer was the best gift that I ever received because it really helped me understand that my calling was to be in healthcare, but not to change my focus on changing stories, but just to help healthcare organizations share their stories. And so as the story goes, I was working with this medical center after sharing with them my horrific experiences, trying to transform the way they treated patients. And I ended up meeting a CEO of another hospital who had a second home in a rural community. And this rural community had a hospital that was, and for those of you familiar with rural health, you know what a Hill-Burton facility is. It was over 60 years old. It was landlocked. They had nowhere to grow, nowhere to go. And as a result of that, they could not recruit any providers. And so their emergency room was staffed with only sometimes a family practice, maybe a podiatrist, whatever it may be. And I tapped into my academic medical center people piece, and I'm getting here. I want to make sure that you all can hear me because I'm getting some notes that people can't hear. And if my Sarah can confirm that, I would appreciate it. You should be able to hear us now. And so I introduced them to this rural hospital, and they ended up doing these 48-hour, 72-hour rotations in this emergency room, which essentially saved this hospital from closing as a result. So I thought, this has got to be a story that we tell. And the reason why I'm here almost 30 years later still doing this is because I believe there are so many incredible stories that need to be told about rural health. And while I do appreciate, as you heard in the clip, that I think it's really important that we focus on the things that are challenging, that are things that are not going right with rural health. There are so many things going well with rural health, and that's why we're here today to talk about that. So again, I pulled something today, one of my favorite organizations, a go-to organization that I look at often for wisdom and webinars and resources, is the Aspen Institute Community Strategies Group. And as you see up here on your screen, there's this great quote that says, "For rural places and people to prosper, the realities and lived experience of the true diversity of people, places, cultures, perspectives, economic and economies must be fairly and fully represented in media information and portrayals. And I think it's safe to say that we still have a bit of a challenge in the United States of America, trying to kind of break rural out of a mold that we hear so often about. You know, we hear older, we hear sicker, we hear poorer, and while statistically that might be true, it is true. There is so much more to be gained from learning about these stories. So why do we tell stories? Well, we know that they are universally impactful, and when told well, I mean, that's why all of us we love those TED Talks, because great storytellers have a way to just reach into your heart and make you feel something, which we'll talk about. They're memorable. I mean, a great story, and unfortunately, so many of the great stories we hear, the memorable stories we hear, are not positive, and that's why we have so many news programs about them. But there's also emotional connections that we make. Many years ago, when I was working in publishing, I worked with an author who wrote a book called Spirit of the Rainforest, and this was about the Yanomamo Indian in the Venezuelan rainforest, and he brought a shaman to the States for us to take to different colleges, and we spoke in front of anthropology students. And when I met Chief Shoefoot, that was the name that he received from those who brought him here. He looked at me, and he was shorter than I was, which is hard to do. And he looked at me and he spoke to me in Yanomamo. And I asked the translator what he said, and his words were so touching to me. He said, "I see myself in you. Do you see yourself in me?" And his message was is that when we see each other, then maybe we can bring new context and meaning to our work and to the words that we use and the stories that we tell. We also tell stories. You know, corporations tell stories to advance their brand, and those who work in rural health space, whether it's academic or otherwise, it's important for us to make sure that people understand what we stand for, and that's why we spend so much money on branding. And then the last thing I say is because it can change. And that's up for you to decide. What can it change? Can it change people's minds, their hearts? Can it change policy? And we know all this is true. And so, what I want to share with you before we bring in our amazing guest of panelists is I have a really outstanding colleague. She's kind of working with me here today behind the scenes, and we do a lot of work together around helping rural hospitals and rural health organizations tell their story. And so there's a framework, and it's based on the story brand framework. And as you see in front of you, as far as storytelling, and I'm going to fess up, I have 6 grandchildren, and I love to read to all of them. And every book that I read, there's a character. Every story has a character. And typically, every story's character has a problem. And after that, that character with a problem meets a guide, whoever it might be, who gives them a plan, who shows them a way, if you will, gives them a plan of action, calls them to action that helps them hopefully avoid failure that ends in success. That's not the only reason to tell stories. Of course, we know in research it's important to tell stories, and you know, when you're writing grant applications, it's important to tell stories. So we're going to touch on all of that today. At the end of the day, and I've come to know this so true in my heart, that as we really work to connect with each other's stories, we have to kind of break through the whole process, the psychology of storytelling, which is the think, the know, the feel. We may think we know something. We may think that we have a handle on something around us in our world, and we may know because we've had firsthand experience. Someone that you trust can tell you a story. You may not know that it's true, but because you think that person is trustworthy, we could say, oh, yeah, because so and so told me. But at the end of the day, as human beings, most of us do not change our behaviors, our position. We don't shift our opinions unless we feel something. And that's what stories have the power to do for us. They have the power to help us feel something, to inspire us to do something different. And to feel is to connect on a deeply personal level. What you see in front of you is a screenshot from a movie poster called The Provider's Documentary. And I was really privileged to be a part of an event that NOSORH for National Rural Health Day a few years back. I say BC, before COVID. And we had on the filmmakers of The Provider's Documentary. And if you haven't seen it, just say, oh, Michelle told us to see it. It is an outstanding documentary film about a health clinic, El Centro Family Health in Las Vegas, New Mexico, and the journey that these filmmakers take us on, these providers who are doing everything they can to help their severely under-resourced community. And when I say under-resourced, one of the things that this movie taught me was that I'm not going to use the word underserved anymore, because I could see from my own eyes and met one of those outstanding providers, Matt Probst, who's a physician's assistant. They're not underserved because there's a lot of people in this community working to serve them. They were under-resourced. And so just that one movie, I say grab a box of tissues. You will cry, and you will be profoundly touched when you hear that story, because when it does, as I said, it inspires you to go the distance to drive change in your own communities and in your work. So I want to kind of tee that up for you, but the real reason we're here is that I can't believe these people said yes to me, but I'm so thrilled that they did. I am going to welcome our three outstanding guest panelists. And right now I'd like to bring in Liz Carey, Tony Pippa, and Sarah Jane Tribble. And let me just tell you a little bit of background information about them. Okay, so Liz Carey, I gotta fess up. I met Liz for the first time when I was hosting Rural Matters podcast, and Liz did a story. Here's the headline: From Dead Guys to Fireflies. Fast-growing tourism doesn't always bring joy. Liz, I'm sure you remember that. But she was writing about this event in Colorado called Frozen Dead Guy Days. And it's a thing. And so I interviewed her and I started digging deeper into Liz's career. So she's a veteran journalist with more than 20 years of experience in the field. She works in Ohio, Kentucky, South Carolina, and she's covered government, education, business, and agriculture in the past, receiving more than 30 awards for her reporting and writing. Some of her other titles include Dwindling Number of Rural Pharmacies Leaves Residents at Risk, Research: Rural LGBTQ adults are more likely to be depressed, anxious, less likely to seek and find treatment. Workers suffer, die while waiting better heat safety rules. Roe v. Wade decision could result in a heavier burdens on rural maternity units. And the last one I'll read to you is nearly half of all rural hospitals lose money on childbirth services. So Liz is doing an amazing job reporting out on the significant challenges that we're facing in rural America. So Liz, welcome to Masterclass. We're so thrilled to have you.
Thank you. Thrilled to be here.
Great. Now my next guest is Tony Pippa, another kind of person I met through doing that podcast, and it was because he happened to be a guest as a part of the series we were doing with the Robert Wood Johnson Foundation on reimagining rural policy. So Tony is joining us from another country today because he's traveling doing his thing. I've been following him on Twitter. I'm like his groupie. Tony is a senior fellow with the Center of Sustainable Development, housed in the Global Economy and Development Program at Brookings Institution. He studies place-based policies to improve social progress in the United States and globally, including through use of sustainable development goals. At the local level, he is also considering the future of U.S. multilateral aid and applicability of lessons from international development to improving rural development in the U.S. Tony, your work is so important. Thank you for joining us today.
Glad to be here. Thanks for having me. Looking
Thank
forward
you.
to it.
Yes, thank you. And then, gosh, Sarah Jane Tribble, I've been following your work for quite some time. And if you don't know who she is, that's your fault. You need to go find out where she's at, because Sarah Jane Tribble is a senior correspondent for Kaiser Health News, covering the pharmaceutical industry, and specializes in digging into, and boy, does she often overlook stories as a part of the enterprise team. And since joining KHN, she has reported on the orphan drug industry and loopholes in the federal rulemaking process, and created KHN's first narrative podcast, Where It Hurts. And my goodness, does it ever. The list goes on and on. You can find Sarah Jane's reporting in CNN, CNN Business, Business Insider, CBS News, HuffPost, MSN, The Washington Post, and most recently, the USA Today, with a headline, and this is the recent headline: Mismanaged hospitals in rural Missouri abandon their employees health insurance plans. Sarah Jane Tribble, welcome to the Masterclass. Thank you for being with us.
Thanks for having me.
Wonderful. All right, so we're going to get into this conversation. I want to let our attendees know you can ask questions in the question box, and we're going to answer those for you throughout the session. But we're going to go ahead and get started in the conversation. And Liz, I'm going to start with you. I just rattled off a few of the things that you're working on, but tell us about your rural-focused work. I mean, what started you down this path of wanting to write and report on rural issues? In particular, you've done a lot of rural health issues, especially around COVID, which we're so grateful for. We're going to unmute you here, Liz.
Yeah.
Sarah?
We like to tease that I haven't had anything to write about for the past 2 years. I'm sorry. Okay. Well, we like to tease that I haven't had anything to write about for the last 2 years. So, you know, it's been, I'm the daughter of a doctor. He was the head of emergency medicine for the University of Kentucky, but, you know, we were in very small towns. He came from a small town of Louisa, Kentucky. So, you know, I know what it's like for a rural doctor to make house calls because all of the football team came to my house when they got hurt, right? So I've always had really a passion for healthcare and healthcare reporting. I've been reporting for, you know, a dog's age. And when I got the opportunity to do rural health for the Daily Yonder, it was like, okay, I don't know what I'm going to write about. And then the next thing I knew, I was overwhelmed with stories. So we've done everything from, you know, the opioid problems in rural communities to the lack of access to mental health care, the behavioral health for children. Today, I'm writing a story about, again, LGBTQ access to to healthcare, primary health care, and mental health care. I just did a story about rural health and diabetes. So, you know, it's kind of nice to not have to talk about COVID and vaccines for a while. But there's
you have a little bit of a lag with you.
Still are a lot of issues that are out there to deal with.
There certainly are. Tony, tell us. I mean, you've had.
Can you hear me?
Yeah,
Okay.
we can hear you.
I
There's
can't
just
hear
a little bit lag. That's okay. So I'm going to jump over to you, Tony, because you have had. I mean, one of the reasons I'll fess up to you. One of the reasons why I was really just excited to have you here is that not only your writing and your research is outstanding, but you also share. You're a sharer, and your work shows up everywhere, and you amplify people who are doing really good work. And I think that's another part of storytelling, because if no one's listening, you know, the story's still there. So tell us a little bit more about why rural for you, and in your research, and how that fuels kind of expanding the narrative around rural.
Yeah, well, I grew up in northeast central Pennsylvania. I grew up in the anthracite coal region. I'm a small town boy. You know, I came from a town of 2,000 people. And actually that town was doing well when I grew up, and it's still doing well. But the towns that surround it have been in a steady decline for decades, actually. And yet the people there, I wouldn't say are in decline. It's that we haven't really properly invested to enable those communities to thrive and to work. I've been the foundation president of a family foundation in North Carolina. We were sometimes the first philanthropic funder in communities of color, literally, I would say railroad track towns where the African American community was across the railroad track. And so their political power was marginalized sort of consciously. And yet the innovation and entrepreneurialism of the people in those communities was amazing. And being a philanthropic funder in those communities, we wanted to focus also on kind of what the root of the problem is. We knew that we needed to support them in what they were trying to do, but we also knew that there were barriers that they were beating up against. And I think that that's an important part of the story. You know, I came back to rural after, like, as you said, going off and focusing on international development. I was in the federal government, where we were quite focused on and went through a lot of reforms, actually, to make sure our investments were having as much impact as possible overseas. And I think when you come from that environment, I mean, just to be honest, there's not a strong constituency for sending government money overseas to poor people in other places. And so you have to stick together and you have to amplify a story. And it also is a story that's at risk of being taken in a negative way, that there's like a sense of hopelessness or an aura of hopelessness, which I don't think really exists, especially when you get to the human element. And I hope we talk a lot about the human element. We already have started that. But I think, you know, one of the reasons why I focus on rural community economic development right now, and most of my research is focused on how well federal policy is or isn't effective in meeting the needs of communities who are seeking investment and want to renew and revive and revitalize. And frankly, there's a mismatch between what's available and what the assets and the strengths are in those communities. And I think that's a story that we need to get right. And rather than have it be an era of hopelessness, to show actually the innovation, the strength, the community mindedness, and the resilience of those communities is really important. At the same time as I think we show the barriers that they face, sometimes out of their own control.
There's this saying, what you focus your attention on expands. I don't know if you all have heard that, and so I kind of feel that way. I mean, I know that we have to focus our attention on the challenges. I like the idea that if we focus on solutions, people say, hey, we could probably do that here too. Sarah Jane, your rural story is really interesting to me. I was, my whole family is rural Minnesota, and my father was the only one who left the farm family for the Chicagoland area, but my rural roots are very strong. And if you could just tell us a little bit about why rural for you and storytelling kind of together.
Yeah, but first I had a little bit of news off the introduction. So Kaiser Health News created its rural health desk earlier this year. So we have a rural healthcare reporting desk. I'm the senior correspondent for that now. I'm based out of DC, but we have reporters in Minnesota, Michigan, Iowa, South Dakota, and that's on top of our state's reporting teams that are across the US. So I just kind of wanted to tell the audience that we have a big focus on rural here at Kaiser Health News now. And it is really a national, hopefully diverse focus is what we're going for. My rural story, it's, you know, I grew up in rural Southeast Kansas. I am the first in my family to graduate from college. And I got out, I guess is the best way to put it. I left town. But I like to, you know, my family all lives in southeastern Kansas. My parents still live on the gravel road I grew up on. My sister lives nearby, and my husband's family is also in rural Texas. So we have very strong rural roots going back. And you mentioned the Where It Hurts podcast, which resulted from my connections there locally. The podcast is based out of Fort Scott, Kansas, which is not where I grew up. It's about an hour away, but it's southeastern Kansas. And I was so startled to learn that it was one of the poorest parts of the state with some of the worst health outcomes, which is why that really kind of woke me up, made me really go, I've done healthcare stories for a very long time across the US, but that one really struck me.
Yeah, thank you for that. So, Sarah Jane, I'm going to stay with you because Where It Hurts, it's a really incredible podcast. You tell the story of a community gripping with the closure of their hospital. And the trailer for the first episode is No Mercy, which I thought was just so appropriate, followed by chapter 1, It Is What It Is. And yeah, I've worked with many, you know, part of my biggest job is to help rural hospitals stop themselves from being so vulnerable and closing. And I hear that it is what it is. So can you describe for us how you came to bring this story to life and what you hoped listeners would come away with, and maybe some feedback that you're hearing as well?
Yeah, so this story resulted back in 2019. The Fort Scott Hospital in Fort Scott, Kansas had closed in December 2018. And just before that, sometime in the fall, I received a call from my mom. We were just gossiping as usual, and I had known that another Mercy hospital nearby had closed earlier, another year earlier, I believe it was, in Independence, Kansas, maybe 2 years earlier. And when she said Fort Scott was closing, I was just kind of thunderstruck because I remember going there on school field trips, seeing the old fort and being in awe of what a cool town it was. And to think that the hospital was closing just really, I don't know. And there were quotes in the local newspapers from the president talking about Medicaid expansion or lack thereof in Kansas. So I went to the editors and I said, hey, you know, this might be a good example of the turmoil over Medicaid expansion after the ACA. and nothing happened. we didn't do anything for a while. And then in December of that year, about 3 weeks before the hospital was set to close, our executive editor, Elizabeth Rosenthal, stopped me in the hallway here at KGen. This is BC before COVID. And she said, can you get to the hospital before it closes? Mind you, I was covering pharmaceuticals then, but I was going back to Kansas a lot for some family stuff. So I knew the flight schedule. I was like, yeah, I can get there. And, you know, the CEO of that hospital, for whatever reason, she let me come in. And that's where it began. I came back with a very long story. And when I got back, Libby asked me if I wanted to do a podcast. So we did a series of stories with NPR, and then we did the narrative podcast with all the tape that I gathered.
Thank you for that. I mean, I think the Fort Scott story, kind of, you overlay that with so many other rural hospital closing stories and different location, but the impacts on the community are the same. So Liz, I'm gonna turn over to you, and I just want to reassure everyone we got lots of great questions in the question box, so we are going to get to those. You know, Liz, you do pretty active in your work, and I know you tap into a lot of resources, but I wonder, in your work with Daily Yonder and others, how do you decide what to write about? Is there a particular objective for you in engaging readers when you're thinking about what you're going to write about? I think that would be an answer that folks would like to hear.
Since most of my rural health reporting is with the Daily Yonder, we're really, really rural focused. You know, it's very, very rural centric, and we want to talk about the things that maybe nobody else is talking about. For instance, in the reporting that I did the other day about the diabetes in rural, you know, that it's deadlier for men, it's deadlier for the Black community. But I was talking to somebody, and I was talking to her about her experiences with, you know, Medicare in South Carolina, Medicare in Virginia, two completely different ways of dealing, you know, of getting in the system or access to the system. But when I was going to thrift stores and flea markets and eBay to get test strips, because of our poverty, and she was not able to access them through a regular, you know, the regular thing. She could get the medication through the pharmaceutical companies at a lower cost, but the test strips, she couldn't do that. And you know, those are things that I don't think that, you know, Joe Rule has an idea of. It's not something that a policymaker has an idea of. It's something that a healthcare provider probably sees on a regular basis. And when I was talking to another healthcare provider in Minnesota, she's like, oh yeah, we see it all the time. They get these test strips in eBay, and then they're expired, so they're getting false readings. She sees it, but she didn't think that it was a big deal, or that we would all know about it. So these things are things that we want to talk about to make sure that everybody understands what the situations are as they apply specifically to rural communities.
Thanks, Liz. We have a little bit of lag on your end. That's okay. I just want to make sure everyone can hear you. You know, Tony, I'm going to switch over to you because, you know, you, as we said, you have a special focus on considering the future of U.S. multilateral aid and the applicability of lessons from international development to improve rural development in the U.S. And this is curious to me and might be to others. So first, I want to understand from you, what connections do you see between health and the context of rural development? I mean, I can see that I know the financial impacts of a rural hospital, for example. I mean, I've got all the statistics of how millions of dollars are generated back into the community. But what are the connections that you see between health and rural development?
Yeah, so those statistics. So one, it's just good to watch the Senate Agricultural Committee's hearing on the care economy to get all the economic statistics. I mean, you know, the economic impact of a hospital closure with per capita income going down and unemployment going up is pretty immediate. But I mean, the fact of the matter is, without access to care, without good child care, or without mental health access, it's really hard to have a strong basis for economic development and community development. These are basic standards of which people are going to want to be able to be healthy. They're going to want to make sure that their family is cared for, whether they have young kids or whether they have elderly parents. And to be able to feel secure about that is actually just a key building block, really, for community and social development. It's going to be hard to build an economy without ensuring that you've got access to the services and the health services that you feel like you need to be able to thrive personally.
Mm. Yeah, I think that all really great points, and that kind of a follow-up is, what are some examples of the lessons that could be applicable for rural development in the U.S., just based on the things that you're seeing elsewhere? And if you could take that and overlay it to a rural community, what are some things? Because we know that not every rural community is the same. I tell people, if you work in the Northeast or the South or the mountain states, one size certainly does not fit all, but certainly there are lessons that are applicable across the board. And then part of that too is just how in our storytelling, like Liz, when you write a story, and Sarah Jane, when you write a story, you're kind of thinking about a storyline. I wonder, Tony, if you think it would help us if we connected more dots?
Yeah. So I think, so first off, highlighting the diversity and pointing out the diversity of rural, I think, is really important. I mean, that was one thing. So let me tell you a story. 15, 20 years ago, international development was almost shut down, right? People were just not really interested in sending money overseas to people who they thought were extremely poor, and felt like basically it was a fool's errand. Like we were throwing money away, and even policymakers in Washington almost shut down pretty much most of the aid that we gave overseas. And then a couple of years ago, I'm actually coming out of a conference on U.S. rural development, and I checked my email, and I had a notice from my former boss at the Rockefeller, who's now at the Rockefeller Foundation, Raj Shah, and it was to launch a podcast with Malcolm Gladwell called Solvable, right? And so you go from within a 10 to 15 year period of thinking of like an aura of hopelessness to, wait a second, we're like on the cusp of actually doing great things together, and any problem that's out there in the world can be solved. And I think that's where we want to go, actually, with how we think about the stories in rural America as well. Not that they're easy to solve, not that there's not challenges, and even systemic challenges at that, but that they matter. And I think part of that is, poking holes in a lot of myths. And we did that a lot with overseas development. You show the diversity. Not every country is the same that we're investing in. Not every political system is the same that we're investing in overseas. There's a huge diversity of rural America, racially, demographically, even the topographic, features of rural America, and economically. Lots of different kinds of local and regional economies and local assets. And I think highlighting that is really important. Giving people who live in those communities their voice to tell their stories, that is something that we found really powerful when we think about different cultures and different places overseas. And I think it has the same power to rural, because it then draws a sense of compelling meaning between the listener and your audience and the people who are experiencing that as well. And highlighting, not just the challenges, but also the resilience and the solutions. I think we want to do it in a clear-eyed manner. And even if that community hasn't solved its problem, or that hospital wasn't able to solve its problem, there are solutions that you could say that maybe was a barrier to this particular situation, and then get to the root of the problem of why. And I think, shifting our mindsets about the innovation and the community mindedness of rural, that's in rural. I gotta be surprised, I'm always surprised. I mean, I live in DC now, and I'm surprised by the amount of people that I know in policymaking who don't have a lot of rural experience. They haven't lived in a rural town. They don't know a lot of people who are rural. And so we really have to make it real and have to show it in all of its nuances, I think, to our audience and to our listener. And I think that's something what we've done successfully kind of on the international side. And it was helped by the internet. It was helped by, you know, a lot more access, direct access. And I think we can do the same for our stories around rural as well.
Tony, I think that is an excellent point. I think about the work that we do with the National Rural Health Association. Every year, we all trek to Washington, D.C. in February for the Rural Health Policy Institute. And I remember meeting somebody from a very remote, more touristy community. And I've worked in many of those, and they call it terrorist season, not tourist season, by the way. And she brought pictures along with her to show her representatives the cost of a jar of peanut butter on the shelf. It was $12. $12 for a small jar of peanut butter. And so to be able to tell the story about what it costs, I mean, that was like, you know, hopefully that's, you know, kind of earth shattering and eye opening for people to understand. And unfortunately, you know, again, it's kind of those shock and awe stories that keep people to move. Sarah Jane, I want to pop over to you because your work is so in depth. So clearly you're doing a ton of research. And I would like for you to kind of touch on your process behind researching any given topic. And later on, we're going to get into some tools of the trade. But when you pull at that thread, you know, when you think about a story, what's the research that you do? What's kind of your process to make sure that to the best of your ability, you're covering the nuances of the story as well?
I mean, the last thing you want to do is somebody who's sitting in, you know, outside of DC and doing stories is to helicopter in. I've worked at regional newspapers for a number of years. Out of college, I was a regional newspaper reporter in Wichita, Kansas, and you know, I did it in the Carolinas and in California and Texas, and I know what it's like to have people kind of drop in. But as far as process goes, it's really about talking to the people. I mean, that's my process. You find some key people to talk to. You find enough people to where maybe you find your character. Maybe at first you don't find your character. You make sure that, from my perspective, because you know this is a national outlet, we try to connect the dots. We try to say, okay, if this rural hospital in the middle of Missouri is having this problem, is it like other problems across the country? Is it a trend? I go to people like Tony and other researchers to ask them questions and to look at their research. The Robert Wood Johnson Foundation and its county rankings was invaluable for the No Mercy Project, or It Hurts Project, because you can look at those rankings and get a general idea of the health outcomes in a county specifically. Then you can dive in, go to the health directors, go to the state websites, start calling the experts at the local level. And really, I like to go places. Like, I like to go and visit the town. I want to be there. When I go, I don't stay at the chain hotel if I can help it. I try to stay someplace where there's a local person who's running their own place. And I have had the most wonderful experiences. Somebody recommends a restaurant, I go to that restaurant. If there's a gas station where I see a bunch of people gathering, I'll go there, because the stories don't happen unless you talk to the people who are living and experiencing them. And I think there are a lot of connective tissues across rural America, even though it's very, very diverse. I think when I've gone to communities the last couple of years, they don't want to lose their hospital. But when you ask them what it is about their hospital that they love, it's always, you know, they love the people, they love the personal care, they need the emergency department, right? They want the OBGYN if it still exists. They want grandma to become home from the major tertiary centers and be able to stay there for her pneumonia care or her rehab care. That is a commonality. And so you talk to people about that too. I feel like I got a little off your question, but yeah, my process is talking to people and reaching out to the experts to ask questions and read their papers.
Yeah, I mean, 100%. I do the same thing when I work. I kind of get in. I am mindful about the way I'm dressed. Although I did have one hospital in Iowa, woman came up to me. She goes, "You're not from here, are you?" And I said, "Why?" She goes, "Your hair's not big enough." That kind of tipped people off for that. Gosh, that's a great point. And I have a question that I think I'm going to pose this to Liz and Sarah Jane, because this came in. Are editors interested in speaking with rural hospitals that recently invested in new technologies to better serve their patients? And I'd be curious to hear what your response is to that, because working with hospitals, they want me to kind of share, we've got new doctors, we've got new technology. Why don't we want to share these stories more? What would make an editor interested in hearing about that?
Yeah, I mean, I think that we're interested in all the stories. I wouldn't say that a new technology was automatically a new story. People have been doing 3D mammograms to draw in patients for a long time in rural communities. The idea of investing in new technology, is this a trend? Is it just one hospital? From my perspective, one hospital doing something is maybe not just a story, but is it telling on a larger scale? Are we investing in new technology because there's a new payment mechanism at the federal level? And that's going to mean that kind of new technology is coming in across the US. That might be interesting. There's a lot of questions around a pitch like that, if you will, that could bring it forward. There's no one thing that goes, yes, that's a story. There's a number of questions that happen to make something a story, I think.
Yeah, I was pitching this. Oh, go ahead, Liz. Go ahead.
Yeah, I turned off my camera so that you all can hear me a little bit better. But
much better.
One of the things that we try to avoid is for it to come across as an advertisement for the hospital. So if it's it's a trend that we see that we can really identify how it's helping rural in a different way and only affecting rural. So, if we get new, MRI machines in, and urban hospitals are using it the same way that rural hospitals are, it's not really a rural topic, but it is a topic for that rural hospital. But, it's not something that we can say, okay, this is going to affect our rural residents more than it would urban residents. Does that make sense?
Yes, it does. I tell people there's a book called Joe Public Doesn't Care About Your Hospital. It's true, it's a book. And it's kind of interesting because, we see a lot of billboards about mammograms and new providers, but it's really at the heart of the matter is how are you helping people and changing lives kind of thing, which is why I think the EMS story that you saw compliments of a contact of mine at NBC Health News is so, that's a universal problem that we have. Tony, it's kind of the same question to you. I mean, you do a ton of research, and I wonder in your research work, I don't know the quote exactly, but there's something about, data has a purpose and then data in stories has another purpose. So I think I'm kind of curious about how important is data in your story development, Tony? Overall, kind of what's the weight of the data in comparison to the stories that you tell?
I think data allows you to kind of begin an inquiry, and it kind of starts the conversation in your head, or it starts a conversation with someone else, but it shouldn't be the end of the conversation. I think too many times we actually concatenate a lot of different pieces of data, and we feel like we've created kind of a reflection of something, and then we leave it at that. To Sarah Jane's point, I live in data, that it's part of what we do when we're putting our analysis together, but I always start with people as well. I mean, I start both with people who have experience with the data, but I'm also looking for people who are living in communities or maybe working in the field in communities that I'm thinking about, because I want to ground truth that data, and I want to test out on them some of the things I think the data is telling me, so that they can react to it and say, well, that might be the case for this larger, but the conclusion you're drawing from that might be, I might be able to challenge that from my own personal experience, and here's why. So I think it's really important to have, those who are either in communities or have experience in those communities to challenge what you think you're finding in the data. The second thing I would say is you got to know the limitations of your data. And in rural data, that can be very real. A lot of rural data, for example, doesn't go below the county level. And there's huge differentiation between the county level in many places. And so you have to understand what you're working with, and really ensure that you're capturing the nuances accurately. And for example, even the definition that we use of rural can change who is being viewed as rural and who is not being viewed as rural. Center of Rural Innovations, doing a rural aperture project and just showing how when you use a different definition of rural, who falls into that definition and who doesn't fall into that definition. And there's not a huge Venn diagram, actually, for the different ways in which we define rural statistically at the federal level. So I think it's actually really important to be able to be aware of the limitations and also be able to caveat appropriately when you're using the data.
Yeah, it's a great point. Liz, I want to kind of jump back up to you and then Sarah Jane as well. When I was hosting another podcast, we talked about the fact that regardless of your zip code, rural matters. And I'm just curious, Liz, in your work for the Daily Yonder, you're writing to what I would describe, and I'm so thrilled for people to know, and I want you to tell folks about the Daily Yonder in case they don't know about it. It's a great resource, and we'll talk about tools for the trade. But specifically, you're writing, again, to a very rural-centric audience. So how is this factored into your story development work? Tell me that first, and I have a follow-up question for you, because writing for the Daily Yonder might look different than writing for, USA Today or the New York Times, for example.
Exactly. It's writing to the rural-centric audience is everything for all of my writing. I mean, it's everything from knowing about rural communities to understanding the intricacies of how funding affects rural communities. We're looking at electric vehicle charging station networks right now, right? Sometimes rural communities are located on those maps and sometimes they're not. Sometimes we're trying to figure out, whether it's the chicken or the egg sort of syndrome. Are we waiting for everybody in rural communities to get electric vehicles, or will they only get electric vehicles after those infrastructure, charging station infrastructure has been put in place? So, you have to know your audience, and having that rural focus is everything for my stories. I don't want to talk about things that don't impact rural communities, right? And I want to be able to find those human stories within the rural communities that are going to put a face to all of the data. I mean, data is wonderful. I love having data, but that's the starting off point. You need to have that, and I think Sarah Jane's amazing at doing this, being able to find those people that can talk about what it's like to get a $50,000 bill for a flight in an air ambulance, right? Or being able to talk to the one of the stories that I did, I guess it was 2020, which was about a kid who was living in a rural community and didn't have any access to mental health care and ended up committing suicide, and talking to his mom about the struggles that he had to go through to drive an hour and a half to get to a behavioral health provider. That's a really big issue that I don't think that some people understand, how long it takes to get from some places. My sister lives out in the middle of the boondocks. It takes her 45 minutes to get to the grocery store. Those of us who live in cities, that's not necessarily the case. It's like 5 minutes, right? So you don't.
I think that's a real.
If you're not in rural, you don't think about the changes.
Yeah, Sarah Jane, because you're now on the other side of things. I mean, you're writing for national publications with a very broad audience, and I'm curious about your writing and your reporting and your storytelling, and so tell us about how you kind of fashion your voice, if you will, to reach those who might not understand, might not have any rural roots.
Yeah, I should add, though, that nothing makes me happier than seeing the St. Louis Post-Dispatch or Kansas City Star run one of the stories that I've written, because it's a factory in their state or a hospital in their state, because hopefully that's, speaking to multiple audiences. I think that there's one thing I sort of want to really emphasize when it comes to reporting. Rural people are just like everybody else. We all care about our kids. We all care about our families. We care about our jobs, the food we eat. I mean, when I go talk to folks in rural communities, I'm talking to them like I'm talking to anybody else, only I'm coming in with a perspective from a rural perspective, deep rural roots, right? Just as Liz was just saying, I know what it's like to drive an hour to go shopping, because I grew up driving, an hour to the nearest mall because I really wanted those cool jeans in middle school, right? So I know what it's like to do that sort of trek, like a lot of us here, I imagine. So the question I always ask is, how can I bring this person who we can all relate to, right? Like I was talking to, one of the main people for one of my more recent investigations, and I told her, I said, if you would speak about your husband's death and the lack of, the insurance coverage that you had, that you thought you had, and now you're getting these bills in the mail. I think a lot of people can relate to that, not because they're rural, but because they're people. They can relate to that. And so I think part of the trick is making sure that when you're telling a story, it's not going to tug at that person, that audience's heart, unless they actually can relate and connect to that other person. So I think that's really key.
It's so important.
I think one of the interconnectedness of rural communities is one of those things that is a benefit of rural communities as well as a drawback to rural communities. And people, my friends who've lived in cities, don't understand the yin and yang of that. They don't understand how everybody in your hometown knows what you're doing. I grew up, went on a date with a guy that most of the people in my community, he was questionable. Let's just put it that way. My mom knew about it before I got home, and that's that kind of thing you have to.
Yeah, I mean, people know when someone's at the hospital.
To play when you're explain to people, and it comes in doing rural healthcare. Yeah. It comes into play when you're doing rural healthcare reporting, because that, when you're talking about drug abuse, everybody knows when you go into rehab when you're in a small town, and that everyone includes the drug dealer. And he knows that 5 days after you get back from rehab, he's going to show up at your front door, or she, and know that you are out and needing, right? So it's a whole different dynamic.
Different implications. All right, so I have a question from the audience, and then I have a really important question. I kind of want to turn the tides a little bit. So one question, this is for any of you. How often are environmental health issues a focus for your work? I'm thinking about our water crisis. I'm thinking about our climate crisis. So how often, maybe Tony, if we could go around the table, Tony, Sarah Jane, and Liz, what about environmental health and public health? How much of a focus is of that of your work now or going forward, if you have it on your radar screen?
Yeah, it's increasingly a larger focus for us, even though we're focused kind of traditionally on rural and community economic development. It's both because of the impacts of what's happening with extreme weather and disasters and other things, but also just from a justice point of view, actually. And especially for communities that have often been left out of like the political calculus, they often bear the brunt of industry or the waste products of industry, or may have been that power plant, and what's even like where I grew up, in coal, like that's where the coal gets deposited, and big mounds of it. And
I think Tony just froze. So we'll hop over to you, Sarah Jane.
Yeah, I haven't done a ton of environmentally focused stories, but though it's a conversation in our newsroom quite a bit. I know that it's important, and also just piggybacking off of Tony, I think it's an equity issue as well. I think that it's there's an equity misdistribution when it comes to environmental stories. It really does need to be emphasized. It affects these minority populations in ways that we don't quite yet understand yet. I think it's a very important topic to focus on going forward. I just haven't had the opportunity for that tip to pop up in my feed quite yet. If anybody has one, I'd love to work on it.
Yeah, that's great. Great to hear. All right, so now here's kind of my new question as we turn the corner here. In the introduction, we touched on the familiar themes of rural health being older, sicker, poorer, lack of access to services, hospital closures. So we know the reasons for reporting on these topics. It's critical that we do. It's important for us to share with our policymakers what's going on. But at the same time, what opportunities, and Sarah Jane, I'll start with you and then pop over to Liz and we'll see if Tony can join us back. What opportunities do you see for those of us here today to use storytelling to showcase the positive aspects of what's going on where rural and health is concerned?
Yeah, I mean, I think part of it is just looking for solutions, right? And solutions that the community then is part of coming from the community members that they're thinking about, that maybe they don't have support for yet from a congressional standpoint or a funding standpoint, thinking about new ways of thinking of healthcare itself. You know, I had the opportunity to be the healthcare reporter in Cleveland for about 10 years, Cleveland, Ohio. And this is not a rural area, it's an urban area. And I covered the safety net hospital as well as the Cleveland Clinic and university hospitals. And in Cleveland, it was the first county in Ohio to expand Medicaid. I was at the Texas Tribune Festival last weekend and had the chance to see former Ohio Governor John Kasich speak, and he brought up his Medicaid expansion. It started in Cuyahoga County with the safety net hospital. There was a waiver expansion. And the reason I mention that is because of one of my favorite stories that came to mind after I was listening to Kasich speak. And it was, I went to an urban area in Cleveland, and this is a underserved area. This is an area of folks who have long been overlooked in the healthcare system. Woman with diabetes, she had been a frequent flyer at the local safety net hospital, but because of the waiver, she had Medicaid. They hooked her up with a provider who she could connect with on her phone. The hospital had clinics around the area. This is an example of a small community action in place in a big city. And when you think about, say, the rural emergency hospital proposal that's out there right now, there's an emergency department. You can have observation beds. There's a lot of debate about the funding right now. I think that when you talk to folks in these communities and interview folks, there are lots of questions to be asked around how the federal government is approaching solutions and how they would approach it if they had their voice in the mix. What would they ask for their health care? And use those examples from maybe urban areas where there's connectivity and they've already kind of hammered it out in some places.
I think there's some great opportunities kind of talking about, for example, community paramedicine. And we saw a clip about our shortages of EMS. And then on the other side, we're seeing some really emerging things with community paramedicine that's going to be able to do interactions with people in their homes who, diabetes patients and so forth. So that the idea here is that there's interventions before they come to the emergency room. That's just one example.
Right.
Liz, what do you think about kind of changing some of the narrative, and what kind of good stuff do you see you writing about, positive health stories, if you will?
Right. Well, the Daily Yonder is the publication out of the Center for Rural Strategies in Whitesburg, Kentucky. And, so we're not just talking to rural residents, although that is, part of our audience, but we're talking to policymakers too. So our stories, tend to be, here's, what's going on, good, bad, and different. During the pandemic, we did a series of stories on vaccines and what different rural communities were doing to get the vaccines out to the communities, whether it was, free pizza or, big healthcare clinics that would have, drive-through vaccinations. And those were important stories to tell because it provided other communities with ideas as to how they could do that in their community. And so we do want to talk about those good things. I think that unfortunately, for the past 2 years, I haven't really had a lot of bandwidth to do a lot of good stories, but I love doing them. There's a in Cape Cod, I was talking to a woman up there, and her response was that, usually senior citizens are taken when they get old enough to not be able to live on their own anymore. They're taken to the mainland to put into assisted living facilities, and it disorients them. It takes them out of their communities. It takes them away from their families. It takes them away from their friends. So there were some groups there that started to do residential health on the islands to provide them with a way that they could stay on the island that they had lived on our entire life. And those kinds of stories, I think, are good stories. I think that there is a lot of good that's happening in rural communities. We just don't hear about them. right? You know, and we
Well,
can't report on it unless you tell us, right?
I hope. I mean, call me because I have 3 books of Community Stars in the last 3 years and coming. Tony, before you joined, we lost you. The question was, we talk about the narratives of older, sicker, poor, all that stuff, and what I love so much about the work that you do is that it's very the focus, the emphasis is on solutions. And so where do you think there's opportunities for reporting on the good stories and kind of you amplifying the work that you're doing, amplifying the good work that's happening out there as a result of better policy, better funding, economic development, so forth and so on? Let's unmute you here, Sarah, if you want to help them out. Okay.
Oh, there we go.
There we go.
Sorry about that. Had to go to Plan B. I'm in rural Ireland, and so all of a
That's no
sudden
excuse, Tony.
they must have rural broadband gaps here as well. And oddly enough, for an OECD conference on rural development, so we're experiencing it in real time. I mean, I think look, I think there is always, as I was saying a little bit earlier, I think there's always at least a hint of a solution if it's not actually even the predominant theme for a story, if the story is actually about something negative happening. I think that there is usually still some space to say it doesn't happen this in all places, and there may be reasons why, and even referring to that. I think right now, given what's happened with the American Rescue Plan and other legislation that's making resources available, I think it's actually really important we start to look at places where investments are making a difference.
Right.
Because one of the things that actually both makes me excited but also concerns me is whether those resources are really meeting the needs of communities and meeting communities where they're at. And so showing, so for example, I was up doing some interviews for a field visit and showing where a limited capacity government, generally in rural communities, you have volunteer mayors or volunteer city council folks, you might even have part-time city manager, whatever, how important it's been for organizations that are from that region that know the history and have the expertise to be a bridge between those kinds of public resources and enabling the community to help it. Like, I think that's an important story to tell. Because we're not investing in that civic infrastructure of enough organizations across the US in all the different geographies and the diversity that we've talked about. And so I think it's really important. And we use words loosely, like capacity building. Well, frankly, every community has some level of capacity, right? So it's not necessarily have to build the capacity. We can strengthen the capacity that's already there, and they may have limited capacity. And so, Michelle, back to your kind of framing of words and how we use words, I think is really important. And I love Liz's point about both the positive and negative aspects of those strong community ties and the extent to which people know what's going on and so they can help, but also what that might mean in a negative sense as well.
Yeah. That's a great point. I think about something I'm working on now, and the rumor is that they're closing the nursing home, but they're not. They're actually reconfiguring the beds to be swing beds so they can get reimbursed. And so when someone's building a replacement hospital, I say, don't say new, replacement. The words matter. It changes the meaning, and when you change the meaning, you change the mindset. Okay, we're going to do a round table here before we bring in another guest and close out. Just tools of the trade. I mean, everything that we do, your research is important. Make sure that it's accurate. So we've put some handouts in the, as you see on your screen, there's handouts. And one resource that I want to shout out to is Rural Information Hub. They are my #1 go-to place for just invaluable research, and it's vetted, so it's accurate. So that would be one. I've got a few others, but Sarah Jane, why don't you start off and then we'll go around the table. What are some of the resources that you turn to the most when you are developing your stories?
Well, we pay for some background search services, so I do those to check addresses and people and their backgrounds to make sure I'm not highlighting somebody who's got a criminal record and giving them more attention than they maybe should. So that's one. We also, when it comes to tools of the trade, the telephone, calling folks and talking to them.
What?
But I mean, seriously, reaching out to the local health directors and asking them about their data, reaching out to the CDC and making sure you're looking at their countywide data and research papers. Do your checks on medical papers that could be affecting that region or that topic that you're looking at. I tend to look at ProPublica's 990 database when it comes to nonprofit hospitals, and I look at their 990s and read through those. If it's a public hospital, I will go to Edgar and search there for their background financials. What else? Recent investigations, I've been spending a lot of time on state registries, business filings, and so forth. It just depends on the story you're working on. I've spent months FOIAing with the FDA and the NIH. It really depends on the story, but the main tool I would say is putting together a list, keeping a database, a spreadsheet of everybody you're calling so you don't lose track of it. And I like to record most of my interviews if I can. That's just kind of the reporter in me.
Yeah. Because, if you see it on the internet, it must be true, right?
Right. You always verify it. Rule of thumb, you want to make sure you verify it with 3 people that it's real.
Liz, what about you? What are some of your go-to tools for your craft?
Generally speaking, my thing is that I like to talk to people more than anything else, just finding out those stories. So there are people that I'm going to call more often because I know that I can get in touch with them. I know they're going to answer my questions honestly, and I know they're going to help me find resources. So if people are wanting to get their stories out to reporters, I would say, answer your phone. When a reporter calls you, this is your opportunity to tell your side of the story. So take it. I cannot stress that enough. Yes. Take the opportunity, right?
Answer the email, answer the call. Absolutely. And quickly.
Answer the email. And then, if you have a story that you want to pitch to me, and my email address is lizcarey@twc.com. If you have a story that you want to pitch to me about a trend that you see happening or something that's going on in your community, that's a good story. I want to talk to an actual live living human being who's not associated with your hospital, who is an example of that policy or that trend or that disease. I want to talk to the Ellen Borges of the world, who's going to tell me about how her husband died because of faulty test strips. I want to talk to I'm trying to think of people that farm workers who are dealing with excessive heat as a injury because of climate change. So if you're going to pitch a story, it's always helpful for me if you have somebody that I can call up and say, hey, talk to me about your $50,000 air ambulance flight, or your surprise $300,000 bill from COVID or whatever. That's what makes my life easier. But other than that, I'm going to record everything that you have to say, and I'm going to double check most of the stuff that you have to say, and I'm going to be looking at Tony's data and data from just about every other place on the planet that I can find to sort of look for trends and connect those dots and make sure that I'm not spouting things off the top of my head.
That gets you in trouble. Tony, but what about you? Any words of wisdom?
So again, I like data sources that are below the county level. So the CDC Social Vulnerability Index is something that we use for demographic data a lot. And it's also because as part of that index, they use some forward-looking indicators. It's not just things that, are poverty, which actually they lag. Like something will happen and then, then something happens 2 or 3 years after it. So the Economic Innovations Group, the Stress Communities Index, also goes below the county level to the census tract level. And then actually, I like to also look at kind of measures of capacity and different typologies. And so Corey Ann Scally and at the Urban Institute that are re-envisioning rural America typology, where different rural communities have different assets, and she's mapped that out across the U.S. Dante Cini at the American Communities Project also shows, there's a difference between, farm fields in the Midwest and kind of extractive industries in the Northeast, and what happens in the Southeast and what happens in the Southwest. And these typologies try to take that into account. So it can be really helpful. And then Headwaters Economics, which is a regional think tank out in Montana, has done a rural capacity map where they're actually trying to gauge the capacity of local governments. And I think that can be actually quite useful for some of the stories we're talking about here. That's
great. I also want to give a plug, your state offices of rural health, and you can find all of them on the NOSORH, NOSORH, NOSORH.org website. There's a list of all the state offices of rural health and all their contacts, and they have a wealth of information. They are so connected at the state level, and even in kind of reaching into those counties. And so that's a great resource for you as well. And my advice to everyone is, when you are pitching a story, and Sarah and Jane and Liz and Tony, you might have something other to say, just be as thorough and yet brief if you possibly can. Just have the key salient points, the who, the why, the what. Make sure that any contact information you're providing for them to follow up with is correct, that the person is primed, that they're available. So if I say, Sarah Jane, I've got this lead on a really good story, I've talked to the so-and-so, this is their number, they're expecting your call. Just make sure that you do your job and be really thorough with your pitching, and don't expect any reporter or editor to kind of pull it out of you, because they're busy and they have a lot of things to do. Would that be an accurate statement?
Yeah, I would also add, don't take it personally if we don't respond. That's right. I mean, it doesn't mean the story's a bad story. It doesn't mean you've done a bad job. It means we're busy, and we are busy. We're very busy. So, right. Part of it is just getting through at the right time. Sometimes it's just luck.
Yeah.
And I think that when you pitch, make sure that you understand that we want to know how it affects rural residents, or I do, not how it affects your hospital, right? I love the fact that the hospitals are out there and talking about it, but it's not, as my mom used to tell me, it's not about you, right? It's about the people who are reading the stories, and
that's
how
what your Instagram feed is about.
Right.
Right. Oh my gosh, Sarah Jane, Tony, Liz, we are so appreciative that you could join us. And I don't want you to go anywhere, because I am bringing, as we close out our time together, I'm going to bring in our another guest who is with NOSORH. Ashley, are you there? There she is. Ashley is the communications director for the NOSORH, and she's going to share a little bit more with you. Again, thanks to our panelists. We're going to have a follow-up email to everybody with resources after this podcast, or excuse me, after this session. But Ashley, why don't you take it away and tell us about National Rural Health Day and why it's such an important story to tell, the power of rural. We'll unmute you here. There you go.
There we go. Can you hear me?
Yes.
Thanks, Michelle, and thank you to all of our panelists today. We really appreciate your time. Before we close out today's session, I just wanted to share with you another great avenue for sharing rural health stories, and that is National Rural Health Day. So you'll see there on the screen, we're celebrating it on November 17th of this year. So every year, NOSORH celebrates National Rural Health Day on the third Thursday of November. And so we're inviting you all to join us and with the 50 state offices of rural health and rural health stakeholders from all across the country to really shine a light on rural health. So NOSORH is proud to have founded National Rural Health Day back in 2011. And as mentioned earlier, this is our 12th National Rural Health Day. And really it's our opportunity and your opportunity to focus on the positive that's going on in rural health and tell those stories. It's a chance to honor the individuals and organizations who are, they're the people, boots on the ground, working to drive change in their communities and keep their communities healthy. And as you've heard today, those are the stories that that hard work that's often going untold. So this is the perfect chance to help us tell those stories. At NOSORH, one of the highlights of National Rural Health Day is our chance to tell the stories through our annual Community Stars ebook. So we put out a nationwide call for nominations for that every single year. This year we got over 100 nominations, and we are honored to tell the stories of rural health heroes in 48 different states. So look for that book being released on National Rural Health Day, and we really encourage you to read those stories, and hopefully they'll be inspiring to you and possibly inspire you to share some of your own stories. As I mentioned, this year's celebration's on November 17th, but as our tagline has said before, it's not just a day, it's a movement. So it's not just stuff happening on that day, stuff will be happening the whole week. So there's lots of ways to get involved. You'll see there on the screen, go to powerofrural.org. That's our main website, and it's full of free tools and ideas and merchandise, all sorts of stuff. So if you're not sure where to start, that's where you start. Grab you a logo and look for some ideas, and we hope you'll join us. You'll also find on the website a listing of events. If you have an event planned, we're happy to share that. Just let us know what you've got going on, and we have space on there. We're happy to list an event that you have planned and let others know and spread the word. One of the events that NOSORH is doing on National Rural Health Day is our live event at 2 Eastern. It's the Collaboration Carpool, so we hope you'll hop on and join that. We've invited local, regional, and national speakers on that, and they're coming from a broad range of stakeholder groups. So we'll have representatives from broadband, philanthropy, public health, rural health clinics, USDA, and more. So they're just going to go on there, share their stories of what they're doing to drive change, and how we can all work together across sectors to really move the power of rural forward. So we hope you'll join us on the day and hop onto that webinar. And lastly, we encourage you to tell your stories. Share them leading up to National Rural Health Day and beyond. We're pretty active on social media. So when you do share, use our hashtag, the hashtag #PowerOfRural. And then, search for that hashtag, and you can see the different stories being told. We can kind of have our own virtual community of cool rural health stories going on at that time. So we thank you all in advance for helping us move the power of rural forward. We look forward to seeing you all celebrating on November 17th. And to our panelists today, to Michelle, to everybody who attended, we thank you for your time, and have a great rest of your day. Thank you.
Thank you, everyone.
Right. Thank you.